One of the highlights that we would like to share about local hire is that we have actually increased from 2020 to October 2021 by a percentage rate of 22.78 for our local hire efforts. And I would like to say this is due during a pandemic where there were many residents of New Jersey who were afraid to go back to work. And we have been, through our human resources departments, CHROs, or talent development teams, have been able to increase that number. We're also trending higher in our local hire initiatives, including the number of hires by ethnicity. I would like to highlight in the report those that are African American and Black. There has been an increase. And we continue to promote local programs in the community to help increase local hire. I participate with Diana many times, and we go on road shows speaking about our programs and how great it is to work at RWJBarnabas Health. But additionally, we work very closely with our workforce development boards, our one-stop centers that have that direct contact. And right now we have a program where we are recruiting local hires for patient services representatives and CMAs. So the numbers below are coming down, Diana. So let's just, we could go to the next. See, that's October 2021, local hires. So here, this is already highlighting our numbers, but we would like to highlight Community Medical Center, who increased their local hire from 1.67 to 2.69. I think that is a fantastic jump. That is something that is really attributed to that team on the ground, and congratulations to them for what they have done. We look forward to implementing more programs and increasing our efforts in local hires. Diana, I would also like to give a shout out. I know Kevin is on the line. Kevin is a great partner to us, Kevin Meck, in getting these numbers and providing us with opportunities to have insight to what our these reports say to us. So thank you, Kevin, for everything you do for us. So let's just go to the 2019 to 2021 workforce development updates. This is going to be a quick highlight.
If I could just add one comment on the
Sure.
local hiring information. So while these percentages might seem a little low, I will say the 459 is a significant increase from last year, where we were hovering, I think, around 350, 370.
374.
Yeah, and I also want to make a comment that when we say local hires, the human resource team has a very intentional approach of hiring from 18 ALICE zip codes. So, if we were to track all of the state of New Jersey, we would have very high percentages and total count numbers. However, they're looking at the most vulnerable zip codes in their primary service areas. So again, every hospital has around one or two zip codes that they look at. And so I just want to acknowledge that this work is not easy, right? They're being very intentional about hiring, again, from specific zip codes, a very limited number of zip codes. And so I just want to say, thank you and appreciate the work that they're doing in moving the needle in this way.
Thank you, Diana. So the next slide, Diana. So I wanted to share, and I am mentioning 2019 in total, our numbers, what they have been. And this is through a year of pandemic, of having to pivot many things that we did, how training was provided, how we announced training, how we engaged employees and engaged our community to become part of our programs. We have received $3.44 million worth of dollar grants for training since 2019. And I would like to refer back to Dr. Alexander's mention about how important social economic is for the well-being of our community and our members. And 80% I mean, seeing those numbers, I mean, 40%, seeing those numbers really impressed the work that we are doing. We have, we had number of employees that were to be trained, 600. We currently have 522 in training. I want to highlight a couple of really quick, a couple of really nice successes. We have we had a huge need during the pandemic for medical lab technicians. This is a 2-year program offered by Mercer Community College through our partnership, working through the curriculum and finding ways to make this attainable for our employees. We have close to 30 employees in the program, 27, I would like to say 27. We had 5 who just graduated. They finished they received their associate degrees, and they are hired into positions. The average increase of salary, it was $10 an hour. So that's impactful. That's affecting the social economic health of a family. So that's why it is so important that we continue to do this work. And another thing I would like to add is that we have 302 employees enrolled in programs to attain their associate's degree. So we are extremely excited to have them, and to have a total of 522 employees. It's immense. Next slide, please. So, you know, what work? So it's the ability to promote the program to all employees through marketing in the CHROs, definitely leveraging the OL funds with tuition reimbursement and other resources. Our relationships with workforce development boards is extremely important and has helped us elevate the importance of what we do. We have attracted the attention not only of the DOL, but the Department of Economic Development, the Department of Health, the Office of the Secretary of Higher Education. So really bringing all these partners have helped us bring attention to the work that we're doing. And the word is, I always say, is communicate, communicate, communicate. So we repeat the same story, but we love to do it because we have great successes and we know how important it is. Next slide, please. So challenges and barriers, really quick. Tracking of all employees is a manual process with many touches. Unfortunately, I have a team of 2. It's me and somebody else and the manager. So definitely there are many touches. There are removing of barriers from mental health to financial to childcare, elder care. So everything that comes under the umbrella, we address. Also, we would like to still increase the visibility of our programs. You do not know, despite that we put it in our weekly news and we have it on our bridge. Many employees still do not, and we use our CHROs who have been an excellent source of support, and still the visibility of many employees come, oh, I've never heard of this, or this is the first time I hear about it. So we definitely have to work with marketing, and we're going to be working with marketing and the SICI team to make this happen. And encourage managers to hire graduates of the programs. Many times we have a mentality, we want this experience, we want this, we have a vision of what we want our employee to look like. And to be able to remove those barriers and look at them and tell them, listen, start looking at them, hire them, look at their instead of competency based, look at their skills, see what they can bring. So look at those things that cannot be taught, and really give those an opportunity and a chance.